Yeah, she still has the breathing problems a little bit. They're getting better. The thing is, she's having a hard time gaining enough weight because of it. Because of the rapid breathing, it just burns more calories.
That's what they told me.
What it's what both the pulmonologist and her pediatrician told me.
Okay. So. And what is the feeding routine at this point?
So as of now, in the morning, she like nurses first thing, and I'll usually pump the other side while she nurses.
Okay.
But then she eats usually every 3 hours during the day, except right before bedtime. Then we do every 2 hours for the last couple hours.
Eating is nursing?
Nursing, yes.
Both sides or one side?
So usually both sides. That first time in the morning, I only do one side just because it's usually pretty full, because she does sleep a good, like, probably, like, almost 9 hours usually at night.
You get a 9-hour stretch? That's nice.
Yeah.
So that side that you pump, that first feeding, how much do you get?
Today I only pumped for 15 minutes.
And got that.
Okay,
Okay, so you got plenty of milk.
And that's on the slacker
one side.
And that's the slacker side.
That's like almost 5 ounces.
Yeah, because I always nurse her on the side that always gets more.
We can bring the blocks in here.
What did you get, babe?
A 5 ounce, both sides would be a good feeding. This is enough for twins.
Yeah,
That's
I
awesome.
Produced well, and
okay. So, is there any spit up?
Occasionally,
but
not much.
Not large volumes, and not more than once or twice a day.
No, it's maybe once a day at most, and it's usually just like a puddle, maybe this big, like a
Have you
size of a quarter
ever
almost.
pumped later in the day?
Sometimes, I usually pump like at night after she goes to bed. A few hours later, before I go to bed, I'll usually pump again. That time it's usually like 6 to 7 ounces total between both sides.
Okay, so I asked that question just to be sure that some moms will have a lot of milk after sleeping all night, but then as the day progresses, it's less and less and less.
Yeah.
And just wanted to answer for myself the question of, is there enough, right? Because if a kid's not gaining...
Yeah, and I've weighed her like before and after I've done weighed feedings, and it's usually like at least 6 ounces that she's getting.
Substantial.
Yeah.
Interesting. So how many feeds per 24 hours is she getting? Because she's sleeping for 9 hours.
We do, let's see, like 8, 11, 2, sorry, on my phone. 5, 7, 9. So about 6 feeds.
Times 5 ounces at least, probably.
Yeah.
That's plenty.
Yeah.
That's 30 ounces.
Yeah. So
she's not gaining weight.
Faster. I mean, she is, but it's like the way her pediatrician described it is it's on the low end of normal. Okay. So it's still within normal range because they wanted between like half to an ounce of weight gain a day, and she's at like 0.6 or something. So like it's on the lower end.
Yeah.
But her percentile is definitely kind of dropping.
And how tall is Dad?
Dad is about 5'9".
Okay, so not super tall, and you're not super tall.
He's very skinny.
And you're not super tall.
I am not super tall.
Okay.
I am 5 foot.
Okay. So it would make sense that your baby's going to be on the percentiles that match the parents, right? And both parents are a little bit...
And I was really small. I was in 18-month close till I was 3 years old.
Okay.
Like I
So
I stayed pretty small.
I think given that information, and you clearly have enough, and she's keeping enough down, as long as she's getting that 0.5 ounces a day, I wouldn't be too worried.
Okay.
I mean, you're making progress, and it matches. You know, it's funny, the birth size, especially the birth weight, but somewhat the size, but especially the birth weight, is more related to the nutrition in the womb.
Yeah.
And babies who come out really skinny and long will gain more rapidly to get to where they're supposed to be. What was birth weight in this case?
She was actually 7 pounds 10 ounces. She was bigger.
Good size.
Stormy was like 6 pounds 4 ounces when she was born.
So
and she gained very rapidly.
Right. So she was born at a really good weight.
Yeah. And
so there was no need to catch up, if you will. She's already where she needs to be. She's destined, well, with Dee Dee's work, she might end up tall, but
Yeah.
something about body work and releasing tension in the spine allows the spine to elongate, I think.
Yeah.
But, you know, we do have a genetic predisposition to be a certain size.
Mm-hmm.
And so, I don't know, I think things might be okay.
Okay.
Are bowel movements normal?
Yeah.
Okay.
And she just had a nice big one right when we got here.
And she's having good volume of bowel movements. How often?
Multiple times a day. It's
Okay.
usually about every feed, but sometimes a little bit less.
And how old is she?
She'll be 3 months on the 22nd.
Okay.
So just about 3 months.
Don't be surprised if the bowel movements become less frequent, because that could happen too.
Yeah, they seem like they have it because it was every feed,
Right.
pretty, you know.
So
but now it's kind of like there's 1 or 2 feeds a day maybe where she doesn't, and she usually doesn't overnight, which is nice because then
Awesome.
she gets that good long sleep without a
Nice.
dirty diaper.
Yeah.
I mean,
So,
maybe a little pee, but
You know, that's a very common pattern for a breastfed baby. The first week, very few bowel movements because your milk's just coming in. They're not actually drinking a lot.
yeah,
And then as your milk comes in your case, it comes in really well. They got such high volumes that they're going to have to poop it out.
Yeah.
It's just coming fast, so it's just... And then, as their intestinal tract gets more mature, they absorb... Oh, you got a shark! They absorb what's coming so completely that there's very little left to come out.
yeah.
I've had moms who are exclusively breastfeeding around 3, 4, 5, 6 months end up having a baby having 1 bowel movement a week.
Oh wow.
And that can be normal as long as it's soft and not like
And they're not
hard.
seeming uncomfortable.
Yeah, exactly.
Yeah.
Oh, you guys are talking. Take me back to your original question. Let me make sure I did my best to answer.
Yeah. Yeah, it was just about kind of the weight gain, and with her breathing rapidly, and not kind of gaining as much as they would like to see.
Okay, thanks for that reminder. So when babies this young, just 1, 2 months old, are breathing rapidly, or a newborn that's breathing rapidly, if they're breathing so rapidly that they can't maintain a latch, then that's going to be a problem.
Yeah.
But you're not having a problem with the latch.
Yeah, that's not the problem. They said
Okay.
it was more so that they think she's just burning more calories
Yeah.
from, you know,
I
always.
mean, you know,
Thank you for these 2
it's a point. It's possible that, you know, breathing does require muscles, and muscles are contracting, right? So there is some expenditure of energy there. Yeah. So it's getting better. Let's see if the weight gain goes from that half an ounce a day to an ounce a day. But honestly, if you just watch the trend, I think it's fine.
Discuss the